Hello everyone. Today we'll be looking at the examination of the hand and wrist. So this is REMS, REMS, which stands for Regional Examination of the Musculoskeletal System, particularly the hand and wrist region. So if you want to get a copy of this document here, you can just Google Arthritis Research UK and look for examination of the musculoskeletal system, and you should be able to find this document and download it so you can follow along. So I'm gonna first read through this, and then after that I'm gonna summarize it in a way that's easier to remember. So hope this helps. Okay, let's go straight to it. Examination of the hand and wrist. This should normally take place with the patient's hands resting on a pillow, as it can be painful for patients with elbow or shoulder problems to hold their hands up for long. Look. So whenever you do REMS, it always follows the sequence of look, feel, move, and functional tests. So we start with look. With the patient's hands palms down, look at the posture and for obvious swelling, deformity, muscle wasting, and scars. Look at the skin for thinning and bruising, signs of long-term steroid use, or rashes. Look at the nails for psoriatic changes such as pitting or onycholysis. See figure 10. This is pitting, onycholysis. And evidence of nail fold vasculitis. Not sure how this looks like. Decide whether the changes are symmetrical or asymmetrical. Do the changes mainly involve the small joints, proximal interphalangeals and distal interphalangeals, or metacarpophalangeals, or the wrists? Ask the patient to turn their hands over. So just now it was facing down, you're turning it to face up. Does the patient have problems with this due to radial ulnar joint involvement? Do they have problems when they are turning their hands over? This indicates radial ulnar joint involvement. Okay, next, with the patient's hands palms up, look again for muscle wasting. If present, is it in both the thenar and the hypothenar eminences? So the thenar eminence is the protrusion, doesn't say protrusion, the meaty part just before your thumb, and then the hypothenar eminence is the meaty part just before your little finger. If it is only in the thenar eminence, then perhaps the patient has carpal tunnel syndrome. Look for signs of palmar erythema. Look at the wrist for a carpal tunnel release scar. Next, feel. Look, feel, move, feel. With the patient's hands palms up, feel for peripheral pulses. Feel for bulk of the thenar and hypothenar eminences and for tendon thickening. Assess median and ulnar nerve sensation by gently touching over both the thenar and hypothenar eminences and the index and little fingers respectively. Is sensation normal and equal? Ask the patient to turn their hands back over so their palms are face down. Assess radial nerve sensation by a light touch over the thumb and index finger web space. Using the back of your hand, assess skin temperature at the patient's forearm, wrist, and Mcp joints, metacarpophalangeal joints. Are there differences? Gently squeeze across the row of Mcp joints to assess for tenderness, watching the patient's face for signs of discomfort. Bimanually palpate any Mcp joints and any PIP or DIP joints that appear swollen or painful. Is there evidence of active synovitis? The joints will be warm, swollen, and tender and may have a rubbery feel, or you may even detect effusions. There's a quick way to go through all of the small joints of the fingers. I might include it in this video. Are there hard bony swellings? Check for squaring of the carpal metacarpal joint of the thumb and for Heberden's notes on the distal interphalangeals. There may be evidence of previous synovitis, thickened, rubbery, but non-tender joints. Compare one joint with another or with your own to decide whether the small joints are normal. By manually palpate the patient's wrists. Finally, run your hand up the patient's arm along the ulnar border to the elbow. Feel and look for rheumatoid nodules or psoriatic plaques on the extensor surfaces. Look, feel, move. So let's just recap a little bit. I'm losing track. With the patient's hands palm down. Okay, look. So palms down, you look, and then look at the nails and everything, and then turn over. You see if they can turn over, and with palms up, you look, and then feel. You feel for pulses, thenar and hypothenar eminence, nerve sensations. Then ask them to turn their hand over, and then nerve sensation, temperature, tenderness, small joints, hard bony swelling, small joints as well, palpate wrists, MCP tenderness, then small joints, then wrist, and then ulnar border and elbow. Okay, look, feel. Now we are going to move. Ask the patient to straighten their fingers fully against gravity. If the patient is unable to do this, it may be due to joint disease, extensor tendon rupture, or neurological damage. Ask the patient to straighten their hands fully against gravity. If the patient is unable to do this, it may be due to joint disease, extensor tendon rupture, or neurological damage. This can be assessed by moving the fingers passively. Okay. So if you move the fingers passively, you are able to move the fingers passively. It's more likely that it's a nerve or muscle problem. It's not the joint problem. If it's a joint problem, you won't be able to move it passively. Ask the patient to make a fist. If they have difficulty tucking the fingers into the palm, this may be an early sign of tendon or small joint involvement. Move the fingers passively to assess whether the problem is with the tendon or nerves or in the joint. I've mentioned this earlier. So if passively you're able to do it, it's less likely that it's a joint, more likely tendon or nerves. Assess wrist flexion and extension actively by making the prayer sign and passively. Actively and passively. In patients where the history and examination suggests carpal tunnel syndrome, perform Fallon's test, force flexion of the wrists for 60 seconds. In a positive test, this reproduces the patient's symptoms. So this is Fallon's test. You hold this for 60 seconds. Assess the median and ulnar nerves for power. This can be done by abduction of the thumb. This is the median nerve. Abduction of the thumb and finger spread, which is assessing the ulnar nerves. And then ask the patient to pick up a small object. Oh no, dysfunction. Okay, assess the median and ulnar nerves for power. Then that's all for move. So back, I just gotta get my meridians right. Move. So ask the patient to straighten their fingers fully against gravity, and ask the patient to make a fist. and then do it passively if he's unable to do it. Assess wrist flexion and extension actively and passively. And if indicated, do a phalanx test, fixed flexion for 60 seconds. Then assess median and ulnar nerves for power. This can be done by abduction of the thumb, buka the thumb, and finger spread respectively. Okay. So next is functional tests. For the functions of the hands, ask the patient to grip your two fingers to assess power grip. Ask the patient to pinch your finger. This assesses pincer grip, which is very important functionally. Ask the patient to pick up a small object, such as a coin, out of your hand, or check their ability to undo buttons. This assesses pincer grip and function. So pincer grip twice. Pinch your finger and pick up a coin. Okay, now let's summarize everything. Examination of the hand and wrist, REMS. Always do in the sequence of look, feel, move functional tests. So look first with the patient's palms down, and then remember to do everything with the patient's hands resting on the pillow, because their elbows or shoulder problems might cause pain. So you only want to assess the hands at this point. Okay, put on a pillow, palms down. Look for nails, rashes, redness, swelling, deformity, everything. And then ask them to turn over. You're not touching them yet. Turn their hands over. See if they can do that. And then with the hands palms up, you look for any muscle wasting, any redness, which is pulmonary erythema, any scars, carpal tunnel release scars on the wrists. Okay, next you feel. You feel for, what do you feel for? You feel for pulses. You feel for the bulk of the thenar and hypothenar eminence, and you assess median and ulnar nerve sensation. So you feel pulses, you feel for the muscle, and you feel for nerve sensation. Median and ulnar nerve. Median nerve, you touch the thenar eminence. Yeah. Median, you touch the thenar eminence and the index finger. For ulnar nerve, you touch the hypothenar eminence and the little finger. And you see if the sensation is normal and equal on both the nerves. Then you turn the hands over again. Ask them to turn their hands over and assess the radial nerve sensation by touching between the thumb and index finger, the web space there. Then you assess for temperature. Then you assess for tenderness in the MCP, and bimanual palpation of the small joints, and then bimanually palpate the patient's wrist and go up the ulnar bladder, touch the elbow. Next move, ask the patient to straighten their fingers fully against gravity. Ask the patient to make a fist. If they can't do it, help them do it passively. Assess flexion and extension of the wrist passively and actively. Ask the patient to do the phalanx test if indicated, whether history is suggestive of carpal tunnel syndrome, and assess median and ulnar nerves for power by abduction of the thumb and finger spread. So function, grip fingers, assess power grip, then pincer grip, pinch your finger and pick up a coin. So look, feel, move, function, test. Look, palms face down on a pillow. Look first, turn around, look with palms face up, feel for pulses, feel for bulk, feel for nerve sensation. Pulses, muscle, nerve, pulses, muscle, nerve. So vessels, muscles, and nerves. Vessels, muscles, nerve. Pulses, muscles, nerve. Okay. and then ask the patient to turn over. He is still doing nerve. Turn over, do nerve, and then temperature, tenderness across the MCP, tenderness in the small joints, tenderness on the wrist, and tenderness along the ulnar border, and look for rheumatoid nodules on the elbows. And move. You're gonna ask them to straighten their fingers fully against gravity, and then make a fist, and flexion and extension of the wrist. So fingers first, then wrist, and then median ulnar nerve for power. Function, grip, power grip, pincer grip, pick up small object. It's quite difficult to remember, but we'll try it again. Last round, examination of the hand and wrist. REMS, always do in look, feel, move, functional tests. Look, you're gonna look when the patient's palms down, and then turn around and look when the patient's palms up. Now you move on to feel. You feel on the pulses, muscles, and also the nerve sensation, and turn around and continue with nerve sensation, and then temperature and tenderness of the MCP, tenderness of the small joints, and tenderness of the wrist. And then after doing the wrist, you go up the ulnar border and touch, palpate up to the elbow. Now move. Do the fingers first. Ask them to open their fingers fully against gravity, and then make a fist. See if they can do it fully. If not, do it passively for them. Assess. Then after checking the fingers, you do the wrist. So extension, flexion of the wrist, passive and active. And if indicated, do a phalanx test, and then assess median and ulnar nerve power by abduction of the thumb and finger spread. Look, feel, move, done. Functional test, power grip, pincer grip. Pincer grip, there are two ways. Squeezing your finger and picking up a coin from your hand. Okay, I think that's simplified enough. That's all I have for you. Thank you.